Probably one of the most common errors that the US spends about $40 billion a year on is medication errors.
Mm.
So when nurses are taught in school safe medication administration, they're given 5 or 6 steps that they should do on every single patient. And many times they skip those steps because they're in a hurry, short staffing or whatever, they're overloaded. It's just a really busy job. But that is what leads to patient harm and many times, unfortunately, patient deaths. For example, there was one, I did a social media post on this a couple days ago. A nurse in the ICU had two patients. One had a diagnosis of pneumonia, the other one was in septic shock. And so, there for a massive infection. Well, the nurse hung what she thought was the antibiotic for the patient with pneumonia. She didn't. She hung the other patient's medication, which is a really strong vasopressor to when somebody's in septic shock and their blood pressure is super low, it vasoconstricts to help keep the blood flow to the major organs. Well, the patient with pneumonia did not need that medication, and she couldn't figure out why the patient's blood pressure was sky high. Finally called someone to get some help, and they couldn't figure it out, and the lady died. And then they finally figured out the error. She was given the wrong medication.